right, welcome. Welcome. This is a very first CareNational podcast. This is Tom Hasara. I'm the president of CareNational Healthcare Services. I'm joined with our CEO and owner, Aaron Lebovitz. And what we wanted to talk about today, and really in these podcasts in general, is a lot of times we have good conversations here in the office where we're talking about things that affect our clients, health plans, health systems, as well as our candidates that work there. And a lot of times we talk about things that just affect the scope of healthcare in America in general. And so we thought maybe some of those conversations would be worth sharing with you, the listener, through these podcasts. And we hope you find some value in the topics that we discuss.
And these topics may change, over time here as we, continue this podcast series. But to start off, obviously there's a lot going on in terms of the merger and acquisition space right now, especially with both payer and provider organizations. And I know there's still a lot as far as regulators are concerned in terms of how those will shake out. But that's, one thing we wanted to kind of cover and sort of update, I guess, maybe our listeners on. The other is, hopefully, and again, avoiding the political nature of some of these topics, really just talk factually maybe about how this might affect the grand landscape, I guess, of healthcare, especially in certain states, as well as, what's kind of critical to us in terms of how it affects our business. Full disclosure, we're going to talk a lot about Medicaid or what is referred to as Medi-Cal in California, which is essentially healthcare coverage, government-sponsored for low-income individuals. We do work with a number of these Medicaid plans. So maybe let's start there in terms of, just chatting a little bit about this recent decision. I know we've had a little bit of a discrepancy here maybe in terms of how many new members this is going to cover, but essentially January 1st, California will begin coverage on low-income undocumented immigrants. This is going to cost the state of California $98 million. One of the questions I had initially was, well, who's going to cover these members? Again, we work with a lot of these Medicaid plans, and so I was kind of curious who's going to get the bulk of it. My guess is that it will probably just really depend on where these low-income individuals live within the state. There's probably a dozen or so managed care organizations that service the Medicaid or, again, Medi-Cal population there. Again, we work with several. Just to kind of quickly name off, some of those. We have Promise Health Plan. That was really an acquisition of Care First California by Blue Shield of California. Another organization is Centene Corporation, which has both California Health and Wellness as well as HealthNet. There's Molina, LA Care, IEHP, CalOptima, Alameda Alliance for Health, Anthem, Contra Costa Health Plan, CalViva, Kern Family Care, Aetna, San Francisco Health Plan of San Joaquin, and Santa Clara Family Health Plan. Tom, could I get your opinion in terms of, how this will kind of affect maybe California, our business, kind of get your opinion in terms of how this may lead potentially to kind of that road to universal health care in America?
Absolutely, and thanks, Aaron. What's interesting to note, just as Aaron mentioned, we do work with a number of those Medicaid, those Medi-Cal plans in California. My quick count brought it up to about 9 of those 15 companies that CareNational has supported for their staffing services and hiring needs as well. So we're very much entrenched in working with these companies that are facing these challenges and rising to the occasion as well. In terms of what this is, again, a lot of the news media has maybe referred to it as a universal health coverage. And again, that's something that, as a result, of something the governor himself has used to kind of term this. He was formerly the mayor of San Francisco, and he did roll out universal health care coverage within the city of San Francisco, and he's made very public statements that he's interested in trying to achieve the same result within the state of California. The one thing to clarify on this particular change is California was already covering undocumented immigrants of a certain age, basically under the age of 19. Children at that age were being covered by the Medi-Cal plan. What the current expansion that was just recently signed into law this week actually would be to expand that coverage all the way up to 25, kind of in line with the Affordable Care Act, which expanded some health care coverage for parents up to that age. That would be, as Aaron mentioned, $98 million price tag. Well, the way it works in California with Medicaid eligibility, each county determines that for the individual. What this law does is it expands the eligibility that's there in principle, and again, each county would make that determination on a case-by-case basis for the people that are enrolled in it. Now, what does that mean, though, for the health plans that are involved in this? Obviously, those 15 companies that service Medi-Cal coverage, they're going to have an increase of all of 90,000 at least additional members that they're going to have to service. That will mean an increase in some staffing requirements. That'll mean some adjustments in terms of their operations, expanding their operations. It may even include expanding additional brick and mortar sites potentially, depending on where these individuals live and what counties and health plans service those.
I could probably add in there too. I would imagine a lot of historically anyway, especially for California as it was, we would see orders for bilingual Spanish speaking case managers. For example, imagine there's probably going to be an increased need for those types of more specialized skill setted types of folks.
Yeah, I would say that would be probably a safe bet as well, and again, well within lines with what we've seen historically. And again, the piece that we just mentioned is probably getting the most amount of coverage. Again, it was recently signed into law. It is part of their overall California budget. That piece was already cleared. Another part of the budget that expanded health coverage also included expanding eligibility to seniors and lowering the threshold for pay, so that basically there's additional coverage for individuals identified as being low income on the senior side of things as well. So they're not just expanding their Medi-Cal coverage, but they're also expanding other coverage within the state as well.
Well, it sounds good. It sounds like it'll be interesting to see how some of this shakes out and who picks up a majority. If those members aren't just kind of equally, essentially spread, throughout those different plans. Maybe let's move on to more in the news as it relates to some of the mergers and acquisitions out there. We really don't have time to cover everything. I mean, there's some big ones. United Healthcare, for example, just purchased DaVita. That's a fairly large one, but we wanted to focus on a couple others anyway. One provider, one payer. The merger or acquisition of WellCare by Centene Corporation has recently anyway received board approval to proceed. Again, just full disclosure, those are two organizations that we already are contracted with and work with. But this essentially creates probably one of the largest would essentially create one of the largest Medicaid-focused plans in the entire country. So, Tom, any thoughts here as it relates specifically to WellCare and Centene?
Well, I would point out first and foremost that obviously a merger like this that makes them that increases their stake is going to move them up in the rank ordering of large health insurance companies in America. Right now, both Centene and WellCare occupy two separate slots in those top 5 and top 10 health insurance plans in America. By combining them, both of them, they're going to cover nearly 22 million people across a number of different types of plans, and that's certainly going to increase, is going to bring them up much more towards a competitive edge with the largest health insurer in America, which is United Healthcare.
Do you know how many members, for example, Anthem has as kind of the number 2 player, just out of curiosity? Not to put you on the spot.
I do not know.
I know that United obviously is by far the biggest and more than double the second player there, Anthem, but was just curious to see how, if by chance this would kind of push them into that third, maybe third position or even second position. So
yeah, I don't have those numbers in front of me, unfortunately, but yeah, that's very interesting to see, and that was one of my first thoughts as well, was just where is this gonna fall out if it actually happens. And I think that's the important thing to keep in mind. The piece that's been in the news lately is that their shareholders for both organizations have approved the merger. That is just merely one hurdle. A lot of other steps in the process here, and we've actually seen a number of potential mergers in the past that, including with Centene, where it has not happened because of either internal pressures that prevented it, or generally speaking, it's outside agencies that wind up saying that the merger may not be approved. For instance, with this merger, they need to get Centene and WellCare operating those 26 states, so they still have to get approvals from those regulators in those states. They've got conditional approvals in 4 states, and they're working on more. However, again, that's a slow process to get all 26 states on board. And again, in some of those states, that it means that they'll have to divest certain lines of business in order to become eligible to operate at that size of what they're talking about, because the states are very concerned about making sure that the health insurers are competitive within their marketplace. Mm-hmm. Beyond that, and beyond those state levels, the federal government themselves, the U.S. Justice Department, is going to have to approve this and just make sure that it doesn't violate any antitrust laws because again, the intent is that we're not creating any kind of monopoly or unfair position within that market as well.
Well, I think moving on then to talk a little bit about this Sanford Health potential merger anyway, and this would be an $11 billion health system that would be created by this merger. And again, another situation where we work with components of what this merger would entail. I know, Tom, you're always very effective in speaking about some of those details. I think Gunderson Health System is a component of this essentially headquartered merger that would be out of Iowa. But could you tell us a little bit about this merger at $11 billion?
Sure. So this one is it's with Sanford Health, and they largely operate in South Dakota, North Dakota, and western Minnesota. And again, it's exploratory at this point, but they're looking to potentially merge with Unity Point Health. And as Aaron mentioned, we are contracted with one of Unity Health's subsidiaries. Again, full disclosure as far as that's concerned. Unity Point Health operates in other states. They're largely based in Iowa, but they also have facilities in Illinois and Wisconsin as well. So in terms of geographic overlap, there really wasn't a lot between these two. So that's part of the reason why they were interested in exploring this as a merger. As it stands right now, there's been times in the past Sanford Health has actually looked to expand into Wisconsin before. Back in 2013, they actually attempted to do a merger with Fairview, that would have made them the largest health system player in the Twin Cities area. So again, Sanford Health has been looking to make some expansions over time, and again, both them and Unity Point have kind of agreed that this is potentially a good fit. They're both non-for-profit organizations. Between the two of them, they think that they can not only expand their provider coverage, but also potentially reduce some overlap between each of them operate a small health insurance side of their business as well.
Interesting. Okay. And it's interesting too, $11 billion sounds huge, and it is large, but just recently, for example, I was talking to one of the leaders in talent acquisition over at what was essentially Dignity Health, and they did have their merger approved, which took some time, but that was with Catholic Health Initiative, CHI and Dignity merged to form Common Spirit Health. That is now a $30 billion organization. So it's really incredible, the size and scope of putting these massive organizations together. It'll be really interesting to see how this affects the landscape. Hopefully in the end it improves, healthcare and healthcare outcomes for patients and members of, the hospital systems and the plans that we, serve and work with. So I think, that's a good start to our podcast here. I don't know if there's anything else you'd like to add maybe before we close up, and we can, maybe reconvene here in a month or so and chat in more detail about, what's in the news and anything that's affecting, our business and, those fine folks that we work with on a daily basis, those case managers, those utilization review nurses, those directors of medical management. Tom?
Oh, mainly I'd just like to thank everybody for listening, and again, we'd love to, we enjoy having these conversations. We think they're, important not just for our business model, but for our larger mission, which is improving healthcare in America overall. So, if any of you listening are interested in talking a little bit more with us, you always give us a call. You can give us a call at our company phone number, which is 1-800-974-4828.
Or visit us at CareNational.com. Thanks so much for listening.
Thank you.